Welcome to the Prosperity Health GP series. As accountants and financial advisors who are specialists in the medical industry, we recognise that many of our clients are time poor and aren't available during normal work hours. So we've put together this short series of videos which address commonly asked questions from our clients so that they can better manage their practices and also manage their personal wealth. Today's video will be looking at the topic of making sure that your practice is maximising its claims for various incentives that are made available. And we know that there are numerous incentives available from the government. Not all practices and doctors are doing a very good job at claiming all of those, Brendan. So could you help us to understand, I guess firstly, what are the different categories of incentives that are available?
Thanks, Stephen. Yeah, you're 100% right in that. I guess the reason for doing this video is because not all practices are claiming all the incentives they're entitled to, and that's something that we see on a regular basis. So it's worthwhile looking into it. We're not necessarily experts on the finer details of claiming the incentives, but we definitely can assist you in the right direction of what incentives are available and where you should be looking to get a bit further help on those. As a bit of a guide too, I guess a smaller practice, this could be $30,000 worth of income to them. Larger practice could be hundreds of thousands of dollars worth of income. So it's a significant thing to look at, which is why we wanted to do this video. The different types of incentives that you talked about, there's some broad ones. I might just sort of run through them, I guess, and these will hopefully be familiar to all of you. There's the Australian Childhood Immunisation Register. There's the General Practice Rural Incentive Program. There's the Indigenous Health Program. And then there's probably the major ones that we're going to look at a little bit today are the Practice Nurse Incentive Program, the Practice Incentive Program, and the Service Incentive Payment. So those last three are probably the ones I want to focus on, Stephen, if that's okay.
Sure, that's fine. So tell us about the PNIP program.
PNIP, Practice Nurse Incentive Program. It's really designed to get you to have a practice nurse running in your practice, and that's not necessarily a bad thing in itself anyway. I'd probably recommend that's probably a good thing for a lot of practices. If you don't actually have a practice nurse in your existing practice, worthwhile looking into not to get the PNIP, but also purely from a point of view of making profit in the practice. You might refer to one of the other videos we've filmed recently in relation to the benchmark series, and in that it was an interesting statistic that the higher profitable practices were actually running with a higher ratio of nurses to doctors. So from that point of view, it's a great idea potentially to have a practice nurse, and if there's going to be an incentive offered for it, you might as well take advantage of that. I guess some of the quick ways to look at that is if you're getting accreditation and you didn't have one previously, to have a nurse in, you can get an extra $5,000 straight up for doing that. And I think you get about $20,000 or so for having this practice nurse and meeting the criteria involved in that. And when the criteria for that, I would say probably the best way to find all that information is go to the Human Services website. They have a great little summary of what you need to do and how you need to meet those certain criteria.
Okay. Then we move on to the Practice Incentive Program, and there's a whole range of subset of incentives underneath that category, aren't there? There
is. Again, this will hopefully not be foreign to you, but the simple answer to that is yes, there are a number of them. There's the asthma incentive, the after hours incentive, the cervical screening incentive, diabetes, e-health incentive. Actually, the e-health incentive is one of those ones, just a good example of something you should be keeping up to date in. In early 2016, there was an announcement, I guess, that if you didn't upload a certain number of e-health, of patient records through e-health, then you could lose your PIP. So it's important to keep up to date with that, not necessarily the doctor, but definitely the practice manager, and I would suggest a combination of both, because those are the kind of things that, if you're not looking at this regularly, could slip through and all of a sudden you find your practice isn't getting as much PIP that it could be getting. And that's something I think it's definitely worth keeping on top of. Some of the other ones are the GP Aged Care Access Incentive, the Indigenous Health Incentive. That's actually another good one that I find is quite often missed as well. That simply a matter of making sure that your practice software that you're operating through or that you're using, and that your staff are understanding the full capacity of what should be entered into that. So there's the ethnicity section that you can enter into that practice management software that you're using, and if that shows that someone is Aboriginal or Torres Strait Islander, then that should be coming up on the doctor's screen when they're seeing that patient, and then therefore that doctor would be encouraged to maybe look at their care plans and make sure that they're giving the right level of care to that patient. And if you're giving the right level of care, well, that's a great thing. And secondly, if you're going to get additional income for your practice because of it, that's an even better thing. And it's simply a matter of just ensuring using your own Medicare codes as well when that occurs. So that's something I think all staff need to be aware of, particularly the practice manager and admin staff, or reception staff I should say, when they're booking a new patient in. Understand the patient a bit better, get the ethnicity, make sure you're entering that field in properly.
Okay. What about this third area of service incentive payments?
So service incentive payments, I guess, are typically they run in line with PIP, and typically that's the doctor's income. So the doctor will get the income from the service incentive payment, and the two do run a bit hand in hand. Typically the PNIP and the practice incentive payments, they'll go straight to the practice, and the practice would benefit from that income. The doctors might think, well, why am I doing all of this? But they should be benefiting also from the service incentive payments. So service incentives purely for the doctors, and practice incentive payments and PNIP are really for the practice. And that, it sort of encourages, I guess, to doing things the right way. But then if you're going to do it the right way and give the right level of service that you should be doing, then there's nothing wrong with getting an incentive on top of that as well to make sure that your practice is running smoother.
Okay, so in a busy practice it can be easy to overlook some of these incentives that are available. What action steps should a practice be taking from this point?
I would think if it's not something that you would believe that you're fully on top of as the GP owner or as the practice manager, I would think you'd probably do a learning session, not necessarily with your accountants like us, but probably with your practice manager, your key staff and your doctors. I would have your practice manager reviewing all the incentives that are available and making sure you're up to date with them all and making sure you understand them all. Probably yourself being aware of it as well, and then organising probably something facilitated by the practice manager to run a bit of a learning session for all the doctors to make sure everyone's doing it the right way and keeping up to date with the latest way of doing things.
Thanks, Brendan. Well, I hope you enjoyed this latest in this series of videos, the GP Health series that we've put together for our clients. If you'd like to find out more about the issues raised in this video or see any of the other videos in the series, please go to our website, prosperityhealth.com.au. There you'll also find contact details for our team of advisors and be more than happy to talk to you. Thank you.
Thank you.